of Labor and Industries, and he has been such since 2013. Joel's worked for federal OSHA. He worked for the Employment Security Department, and he has a bachelor's degree, and he also has a master's degree from Syracuse University. And Joel, if I'm not mistaken, correct me if I'm wrong, but as far as the state, the department heads, you're the sole survivor as far as being in your position since the get-go, since 2013, the beginning of the Inslee administration. I think the others have kind of changed hands, or maybe I'm making that up.
There's a few of us still left, Jerry. So there's
Okay.
a handful of us that started with the governor on day one, but there definitely has been transition across most of the state agencies.
Yeah, commerce, transportation, I can think of. But anyhow, thanks for being here today. So I hope, Joel, you have some remarks to make, and you always have something interesting to say. So I'm just going to turn it over to you to talk about what you want to talk about, and then we'll just throw it open for questions.
Perfect. Thanks, Jerry. And thank you, everybody. As Jerry mentioned, I really do appreciate these opportunities to meet, even if it's sort of in this virtual setting. I'll give you an update on a couple of things happening on our end, and then allow for some time for hopefully some interaction and questions. If the technology is working, I do have a couple of lifelines with me. So we have Craig Blackwood from our DOSH program, Chris Bowe for our labor standards program, Liz Smith, who's the agency deputy, and Maggie Leland, our policy director, are all hoping to join us. So between the five of us, hopefully we'll be able to answer a number of your questions. This has certainly been an odd year if you think about all the things that have been happening in 2020. So I really do want to start out by just tipping my hat and thanking the AGC for the guidance and the leadership role that you have been playing in partnering with the administration and partnering with us as we work our way through a whole series of incredibly challenging things connected to COVID. Even just making the technology work has been challenging. This is my fourth meeting of the day, and ironically, what I realized is this is the fourth platform I'm using to communicate. So my first meeting was a WebEx meeting, followed by a Skype meeting, followed by a Teams meeting, and here we are on Zoom. So we've all
have any recommendations? You got any recommendations for us based on that?
I've been taught, Jerry, that I'm supposed to say nonpartisan. So I would say all of them seem to have their quirks. Okay. And we seem to be getting kicked out of a variety of different meetings at different times. I mean, even in my home, there's four of us kind of working out of the house. My wife and I are working, and then my two kids are in school. And so we definitely have a bit of a competition going for some of the Wi-Fi access. So all of that has just been a brand new experience for us. But sort of more seriously, we know the pandemic is serious and it's affected so many Washingtonians. And it's caused us to really have to take some basic steps as we think both in that space of prevention. How do we prevent challenging things from happening to all of us? And then when something bad does happen, how do we focus on recovery, whether it's a recovery for an individual or the recovery for the economy? And I know AGC has been playing a critical role, both in helping on the prevention side in the construction industry, being a leader, and then thinking through some of these recovery issues as it relates to the economy. So what I thought I'd do is just sort of touch a little bit on the prevention side, a little bit on the recovery side, give you a quick update on prevailing wage, and then open it up for questions if that works. On the safety side, I think what I want to start out by saying is how important a role, again, that I think AGC has had. When COVID first started, from the department side, what we looked at is where we have workers who are essential to the economy, who have to be working. What are some of those basic things that are necessary in order to protect workers? And it was the things that we've been hearing about in the media and we consistently talk about: social distancing, making sure that that if you can't socially distance, that we're doing engineering controls. And think about all those sneeze guards that are now up in supermarkets. Looking at ensuring that everyone is washing their hands on a regular basis. ensuring that we have good hygiene in workplaces, that doorknobs and other things are being cleaned, ensuring that there is a plan so that if someone is sick, an employee is sick, they're not coming to the workplace. And if they are sick at work, how is it that they're able to get back home? And then lastly, how are we ensuring that workers are getting trained in some of these basics? So we sort of started out with that generic list of things, equally apropos regardless of the job that you do. But then the next question became, as we begin to think about how can we move from a space where we're all sort of in our homes to begin to expand and begin to open up the economy, how do you apply some of those general concepts to specific areas? And we all know that construction is different than manufacturing, is different than agriculture, is different than a retail store. And so I think the idea began to get struck that we need to have industry-specific understandings and agreements. And I think you all should be very proud of the fact that first out of the gate was the construction industry. And it was AGC, along with some of the other trade associations, and then representatives of the trades and organized labor that sat at the table and crafted an industry agreement, sort of taking those broad concepts and saying, what does that mean for the construction industry? I think the agreement that was reached, that the governor then adopted between the folks sitting at the table, served as a model for just about every other industry agreement that's come out in the state. And I think a number of other states have sort of adopted it. So really, once again, AGC was on the forefront of laying a foundation, not only to protect construction workers, but to show how groups can get together, can think about reopening safely and using that as a foundation for industry by industry agreement. So lots of editing to the agreement in different industries, but most of them started with, here's what construction did, what do we adopt, how do we take that and adopt it to our industry? So on behalf of all of those industries that probably would have had many more challenges had they didn't have a working draft to start with, I want to thank AGC and all of you that contributed to the work of that team for the wonderful things that you did. Since that point then, we have been focusing pretty extensively on providing both consultation support and compliance work to all areas, including the construction industry. So we pulled some data yesterday and took a look that's from March 1st to the end of September. Overall in DOSH, we've done just under 2,500 inspections. And of those, just shy of 1,100 were in the construction industry, which is fairly typical. We all know that construction is one of the most hazardous industries in the state. So, historically, we've had an enforcement presence. Now it's just not just on the commercial side, obviously. It's the commercial side, the residential side, et cetera. About a third of the inspections that we've done have been specifically targeted toward the industry agreements and COVID. Now we're looking at those things in all the inspections, but for one reason or another, it could have been a referral or a complaint. About a third of the 1,100 came back and were specifically focused on the industry agreements and ensuring that some of those expectations were being met. I know that one question that came up was what we're finding as it relates to masking. So we pulled some data. And specifically, if you look at the about 325, give or take, inspections that we've done specifically targeting COVID in construction, there were about 115 that had some violations. Now, that doesn't necessarily mean that they were COVID related, because when our staff are showing up and doing enforcement inspections, they're looking at things like fall protection. They're looking at safety programs, all the things that you've typically experienced, in addition to the specific industry agreements. When we pulled some data, what we found is it looks like about 22 of the inspections where we were specifically targeting COVID, less than 10%, did have a violation connected to masking. And that would either be, in all likelihood, folks not in some ways not wearing masks. So we have found it in a few places, but overall what I would say is I think we're finding general compliance with the agreements that you've all reached. And I think you've had lots of conversations around that. I'll just sort of reinforce again that the base expectation, whether you're working on a construction site or you're shopping in a grocery store, we need to be wearing masks to prevent the spread of the disease. So that's sort of my sense of the safety side. Happy to come back and answer some more questions. On the workers' compensation side of things, wanted to share that overall, we have received in the neighborhood of 2,600 claims for L&I to manage, and about 1,300 claims for self-insured employers. So amongst you, some of you are self-insured where you manage your own claims, and then a number of you are part of the state workers' comp system. So I don't have a breakdown of the number of claims specifically coming in construction. What I can say, it's going to be a relatively small number of the close to 4,000 claims that we've gotten in. As you can imagine, the bulk of the claims are coming from healthcare and first responders. Two other things I do want to mention on workers' comp, just in terms of general updates. First, we have made a decision as an agency for those claims that have come in the door where that are state fund claims, that if they are a claim that is a result of COVID, so it's someone suspected of or having COVID and it's an accepted claim, those specific claims will not be charged against an individual's experience rating. So the typical claim that we manage is kind of like car insurance. The more accidents you get into, the higher your rates. If one of your employees is diagnosed with COVID and they get a claim, those costs will not be charged against you as a construction firm or any of the other industries where we have claims coming in the door. Second thing I wanted to share is we have a proposal out for workers' compensation rates for 2021. Each year we have to set rates. We made a decision as an organization, the proposal that we have out there to get feedback from you and others over the next few months would be, on average, no change in the workers' compensation rates. So basically, the average employer, and I get that nobody is average, would be paying the same per hour next year as this year. Now, the reality is everybody's going to be different. So there's going to be a number of you that actually see your rates go down. There may be some of you that see your rates go up, but in the aggregate, it's going to be about the same. Our projected costs for 2021 are going up, but we're in a space where we think, based upon the fragility of the economy, this is a year where we would not raise rates and sort of absorb those potential additional costs for the year. So that's workers' comp. Then move on quickly to prevailing wage. As you know, one of the changes the legislature made was to require certified payrolls to be filed with the departments. Overall, the feedback I've gotten from the program is that seems to be working relatively well. It started in January. One piece of data is year to date, we have had just under 450,000 weekly reported filings. Now that's through the end of August. So a number of things coming in the door. We've been working on our end to try to make it as easy for you and your subs to be able to file these certified payrolls. And Chris and Liz and I would welcome your input on how that's going. We've been making some upgrades. We're committed to continuing to try to make it as easy as possible to be able to comply with the expectation. We've also tried to do some education and outreach. We've done some YouTube videos to explain how to be able to do the certified payroll, and my understanding is that's had about 9,000 hits. So I'm sure some of you on the webinar today have taken advantage of those tools. And we would look forward to, again, getting your input and perspective. Overall, the other piece then on contract release, we have been striving to continue to be able to release retainage. The latest data that I saw was the median for the contract release, where we have to take a look to make sure that before retainage goes back out to you so you can release it to your subs, that workers' comp premiums have been paid and some other rules have been complied with. The median is about 21 days. I do acknowledge, I think there is a set of specific cases and specific projects that are still under review. Some of them are being audited or sort of working their way through the process. But overall, we've done, since January, if my data is right, we've released about 1,800 contracts on 290 different projects. Last thing I do want to mention, and we're going to be working very closely with Jerry on this, and I'm sure he'll be asking for some input on some of these. We are considering a variety of different potential agency request legislation as we sort of move into the legislative session for next year. And happy to cover some of this on Q&A if you have some, but just quickly what we're looking at is one, a bill relating to discrimination. And so changing some of the processes that we use to enforce the state rules that basically say if a worker raises their hand with an employer and says, hey, here's a safety issue that needs to be addressed. And as a result of that, they are fired or face other consequences and are retaliated against. What are the consequences? So right now, obviously that's not legal. We investigate. We then try to reach an accommodation between the employer and the worker to address the concern. If that doesn't happen, the worker then has the right to go to court and try to sue and use our investigation to try to recoup some of their losses from the employer. What this bill would basically do is make that more of an administrative process where if we do find employers are retaliating against workers, there A, could be a penalty, and then B, we would then have a more hands-on role and a direct role in helping the worker get the recovery they're entitled to. Second is a bill that ran last year and wasn't sponsored by us, but we're looking to potentially request it this year, providing some clarity around safety for temporary workers, really trying to make it clear what is it that the temp agency's responsibility is when they send you workers, and what are your responsibilities, and really making it clear that there is a requirement that the temp agencies are doing generic training and that are working with all of you as the host employer to ensure that the workers for whom they're paying the paychecks are safe. A third piece that we're looking at is giving the department the discretion to be able to modify the training requirements for asbestos supervisors. Right now, it's a quirk in the law. We're very constrained in terms of what training can be required. And as we learn more about asbestos, we want to be in a space to make sure that the folks who are supervising that work have the proper training. And then lastly, a piece that we're looking at probably more impacts the residential side of the house, but just so you know, has to do with property flippers and our electrical program. Under today's law, most people who are hired to do work in a home setting or a business setting have to get an electrical inspection so that we can make sure that the work was done to code and is safe. That does not apply to property owners. What that has done, and we've sort of uncovered this, is it's created a loophole where if someone is going to be in a property flipping business, so they own the home, as an example, they have every intention of selling it, but at the moment they are the property owner, they're exempt from some of these from the electrical requirements to be able to have somebody from the state or municipality come in and inspect the work. We have found a number of issues down the road where we've gone back to some of these places and it's been some pretty troubling electrical installation. So what we want to basically say is, if your intent is to flip the property, whether it's a residential or a commercial property, then the same rules should apply to you as apply to other contractors who do work in the residential or commercial space, to try to create a level playing field and promote safety. So 4 examples of the things that we're considering asking the legislature to consider. Our leg team will be working with Jerry to get your input and perspective on these and other potential bills. And then in conclusion, let me just cover, again, sort of circle back to where I started. I want to thank you for your creativity, your flexibility, your commitment to worker safety in these really challenging times. I think AGC members have historically set the bar really high for employers across the state about what it means to be working in a safe manner. And I appreciate the fact that that absolutely has continued. I would be remiss in talking with all of you if I didn't also do the safety reminder that even in this world of COVID and all of the challenges that we face together of preventing the spread of the disease, we can't lose sight of the basic expectations in safety, and that we still know that the two of the leading causes of workplace fatalities continue to be falls and trenching accidents. And so would again just ask you to re-emphasize trenching safety, fall protection as the cornerstone of the safety programs that I know that you all have in place. And with that, Jerry, I think what I'd love to do is open it up for questions and make sure that we're covering the topics that are on your minds, and that all of you that are out there are able to give us some input and perspective on additional things that we should be thinking about.
Okay, thank you, Joel. And there are a lot of questions rolling in, and we're going to get to that. And before we get to that, a couple of things. One, just want to say hi, Liz. Good to see you again. And two, I was remiss in not saying at the beginning just how much we at AGC appreciate Joel and his staff, really for your kind of open door policy. And AGC and L&I work closely over safety, and very closely with regard to safety. And Joel's always been accessible, really, no matter what the issue is. He visits AGC, he comes to our events, he participates in our safety awards. Liz is always willing to chat with us. Jim Christensen over in Prevailing Wage. And so we have a great relationship with you guys, even when we don't agree on policy matters, and sometimes we don't agree on policy matters, but it's not for the sake of not having open communication. So we really do appreciate that. First question, I'm going to ask the first question with regard to workers' comp rates. Certainly everybody's pleased that we're at really a 0% increase on average for workers' comp rates. But I do have to ask one skeptical question, and that has to do with the supplemental pension funds. There are various funds that go into the overall workers' comp rates. One of those is the supplemental pension funds, and those have gone up by 12%, as I understand it. And could you explain, kind of how come, and why is that particular fund going up so quickly compared to the medical aid and the other funds?
Yeah, happy to do it, Jerry. So when you pay your workers' comp premiums, there are a couple of different funds that you pay, and we calculate them separately, and then it sort of gets aggregated up. And so if you think about it, fund number one is what we call the accident fund, and that basically pays for time loss or wage replacement for workers who are hurt on the job and aren't able to work. The second fund is what we call the medical aid fund, and that basically pays the doctor bills. The third major fund is the one that Jerry was referring to, and that's called the supplemental pension fund. And in essence, what that is designed to do is cover the cost of living increases for those who are on time loss for multiple years, or those in the aggregate who eventually receive a pension. For the accident fund and the medical aid fund, the way we calculate benefits is our actuaries basically do their magic and do a calculation where they try to use data to figure out how many people are going to be hurt in 2021, and over the course of the next 20 years, how much will it cost to be able to pay the time loss and the medical aid. And that's what we use to begin the process of rate setting. How much would we need to collect in 2021 to eventually pay the total cost for those claims? The supplemental pension fund is a little bit different. Basically, that's more as a pay-as-you-go fund. And that the way the legislature designed that fund is every year what we need to look at is how much are we going to be paying out in all of the cost of living increases that happened both this year, but also all the prior years. And then how much money would we have to collect in 2020 and in 2021 to pay for that? I mean, as you can imagine, if you think about somebody that received a workers' compensation pension in the year 2000, they do receive a COLA every year. So this supplemental pension fund is paying the cost of the COLAs that happened from 2001 to present. So the longer you've been receiving benefits, the greater a proportion of the the check that the worker gets is going to come from the supplemental pension fund. When we figure out how is it that we're going to have enough money to be able to pay for that, what we look at is a couple of things. One, we make an assumption of how many hours is everyone going to be working in the state of Washington for that year, because the way you pay the supplemental pension is basically it's an hourly rate, just like the rest of workers' comp. Obviously, that assumption was wrong for 2020. because as a result of the pandemic, we did not have, there wasn't nearly the number of hours of work that would have been anticipated. So that has had a pretty significant impact on the fund. Second thing that's happened is every year in calculating the COLAs, the way the statute is established, it basically says, take the state's average wage, and whatever the state's average wage is, that's the COLA for the year. So every year, the amount of money that we're going to be paying out of that fund is is going to increase as a result of the fact that we're adding another year of COLAs. And so the challenge that we faced is because we don't have a reserve, and we've had less hours in 2020, we were in this place where our actuaries came back to us and said, in 2021, if you were going to collect enough money to be able to pay everything you need to pay in 2021, and at the same time have enough, have a little bit of cash flow, you would have to increase rates by 33%. And we said, no, that just doesn't, that's too much. And so the proposal that's out there basically takes a piece of that and says, let's increase it by 12% to cover the cost that I was just describing. And then because we wanted to be in a place where for the typical employer, it would go down, that you wouldn't feel that 12% increase. We decreased the rates that we would be charging in the medical aid account. So Jerry, that's a long answer. I don't know if that's helpful, but that's sort of overall how we got to the space that we're in.
Okay, that is helpful for me anyhow. And we won't get into it right now, but just suffice to say that the average weekly wage is really not an accurate measure of the actual cost of living. It's really an apple and an orange. And so a little foreshadowing, we'll be talking to you about that in the weeks to come. But with that, I want to turn it over to audience questions. And Lance, I'm going to have to ask you for some help because I got kicked off of the Zoom internet, went down here in Olympia briefly. And so as a consequence, there were a lot of questions that were posed in the chat room that have gone away on my screen. So Lance, I'm going to lean on you to kind of go through the list of questions from the top.
Sure, happy to, Jerry. One of the questions was from Yolanda. Does the retainage have to be released by L&I to the prime before retainage can be released to the subs? Does the project have to be complete before retainage can be released to the subs?
Thanks, Lance. And let me give you sort of my understanding, and then Jerry, jump in if I get this wrong, or the L&I team. So the retainage portion that the public entity has is the piece that's held back. Any relationship between you as a general and what you do with your subs, as I understand it, is sort of outside the scope of what's getting regulated from governments. So it's sort of answered in two parts. The retainage for the overall project that the state or the local entity or the school district is holding, yeah, that is held. But if there's some other relationship that's reached between the general and the sub, that's sort of outside of what we would do. Jerry, is that from your lens an okay way to describe it?
I believe that is an okay way to describe it. So the answer is generally speaking, the general could pay retainage to the sub at any time, but of course the general would understandably want to wait until they got the retainage from the public owner to do so. If there's any general on this call that wants to chime in on that, if we're not saying that correctly, please do so. But I do believe that is the way it works.
That's correct, Jerry.
Great. Our next question, as a material supplier of ready-mix concrete, how is it determined if we're required to report? King County says we are exempt from reporting. However, L&I says we're required due to our requirement of paying prevailing wage to our drivers.
And I'm assuming, I'm looking at the chat myself. Michelle, I'm assuming that's a question regarding specifically on prevailing wage projects. So let's assume that it is. Let me ask either Liz or Chris. You may be better equipped to be able to answer this than I am.
Great. Great, thanks. Thanks, Joel. Crispo, is this something that you can take on? I know that this is a conversation you've been having frequently about affidavit reporting requirements.
Yeah, it is an ongoing conversation that we're having around delivery drivers and delivering of materials. But the statute currently for those who are supplying materials to a public works project are covered under our prevailing wage law. So they are, we do require that they are paid prevailing wage by state statute, and that those are intents and affidavits are filed.
Okay. Great. I'll go on to the next question. Back to worker comp rates related to COVID. So if someone is on quarantine for 2 weeks and apply for workers' comp, our rates will not be affected. Can you please clarify what affects our rates?
Sure. So the first part of that statement, correct. If there is someone that is quarantined directly as a result of COVID, and time loss benefit payments are made, that would not be charged against your individual company's experience rating. Now contrast that with someone that was hurt on the job from a fall, and they're out for 2 weeks, and we pay time loss benefits. Those costs would be factored in as your individual firm's experience rate is calculated. So in essence, there's sort of a 3-step process to calculate your rates as an individual company. Step 1 is to look at the aggregate. So all companies, what are the absolute costs for all employers across the state? Are we going to, on average, increase or decrease from the prior year? Step 2 then is to break it down by what we call risk class, because what we know is construction is more dangerous than office work. And so for each risk class is then a particular rate is calculated. And in essence, what happens there is if for those that had a good year over the last couple of years, their rates for that risk class are going to drop. For those that have had more injuries, their costs are going to go up. So each risk class is then going to be adjusted. Then lastly, what's going to happen is we're going to calculate the experience rating for each individual firm. And in essence, in that case, you're basically being compared against everybody else in your risk class who does similar work. So are you on average having the same workers' comp costs as the typical construction company or the typical manufacturer? If yes, then the rate that we publish is your rate. If you're safe, if your history has been safer and lower costs, you're going to pay less than that published rate. And if your history over the last few years is comparatively worse than others in that risk class, you're going to have an experience factor above 1, which means you're going to pay more. So hopefully that helps answer the question.
And kind of following up on that, another question came along in regards to, it was mentioned that accepted claims with a confirmed case will not affect the EMR. How will claims with a negative COVID results be handled? Will these claims be rejected? I want to be careful in my language here. For claims where after the investigation's done, it doesn't meet the established criteria, yeah, those claims would be rejected. In those places where they are it meets the criteria, but there are no payments. As I sit here, I have to check back with my workers' comp experts and whether it's accepted and then closed for the specific case, or if it's formally rejected. I don't recall what we're doing. But what we're finding, honestly, is there are a number of places where claims are being filed, and what we're finding is there's no cost associated with them. So you have an employee that basically was quarantining for 2 weeks, had a negative test case, and their employer continued to pay them their full freight. So there was nothing for L&I to do. And there certainly are a number of those 4,000 I've described fit into that category. Great. I believe I've covered all the questions that have come through. Are there any other questions? If you have, please feel to unmute yourself and to ask Joel or his team.
And Lance, I just want to point out that Don Guthrie chimed in on the retention and release question. And I think it's good information. The sub can request retention release from GC, and providing they put up a retention bond and the GC files a similar bond, the law requires release within 30 days. So that I think is important clarification on that issue.
Actually, we did have one more question come that was submitted. In regards to CPRs, does the L&I requirement to report void the exemption from King County?
Regardless. So I'm going to use my lifeline here. Liz, Chris.
Yeah, thank you. I think the question is referring to, I believe in King County as an awarding agency, they have reporting requirements around certain certified payroll aspects. There's also a separate requirement in the law, in the state law, around the certified payroll requirement being filed at the state level. So, as far as, and this is Chris, if I jump in, if you see differently, but those are separate requirements. So the state and county requirements are both applying to the contractors. And if it's a contractual requirement that awarding agency is putting on contractors, and unfortunately they do have to follow both. One of the things that we have done is we have developed our state certified payroll systems. Is we want to design a system that is as applicable and as usable for all awarding agencies, so that they start to see that it doesn't necessarily make the most sense to have separate requirements. So if we have a system as much as possible that meets the needs around reporting, around apprentice utilization, around the other types of requirements, then hopefully that should fulfill the interest at local awarding agency level to get what they need and potentially be a one-stop shop for contractors, awarding agencies alike.
Great.
Any other questions? I'm gonna, I know Mandy has some questions, so I'm gonna put her on the spot.
Gee, thanks, Chair. Good morning, Joel. Thank you for doing this. We appreciate you. So I think you alluded to this earlier, and so I'll just lob the question out there. Generally speaking, how do you feel the construction community is performed with regard to COVID compliance in comparison to maybe some of the other industries? Oh, you're still on mute.
Sorry.
There
Yeah.
you are.
That happens just about every meeting to somebody. Thanks, Mandy. Let me answer, and then I don't know if Craig is on, because he probably has more on the ground perspective in terms of talking to inspectors. My sense is that what I continue to appreciate is the fact that construction has come to the table, has actively engaged with your workforce and talked about what is it that we need to do to be able to operate safely. And I think particularly for those of you in AGC, and in part, I think it's because of you're going into this with that culture of safety, that commitment to safety, that active safety program, you've been able to pivot and address some of these concerns. Obviously, I think some of the smaller folks, the folks that didn't necessarily come at it with an active safety program, have had some more challenges, but they have challenges with a variety of other safety things. So overall, my impression has been pretty positive. As we move into the fall, I think we continue to have some concerns about folks who do indoor work, because one of the advantages of being, if in fact, and the data is suggesting this more and more, that this disease can be aerosolized, that where you're in a room with poor ventilation, that creates an additional hazard that may not be happening in the outdoors. So those of you who are doing indoor work, particularly in these coming months, I think I want to re-emphasize the importance of sort of continuing to reinforce and focus on what those safety programs would be. The other thing is, again, overall, and I want to contract, one of the things, and it may just be a quirk of this year, we've certainly been focusing a lot on the agricultural industry, and we've seen both with COVID and outside of COVID, this has been one of a really challenging year for worker safety in ag in terms of the number of fatalities. We have not seen that corresponding tick up in fatalities in the construction space. Again, it could just be the quirk of time, but my instinct is the safety programs that you have in place have done a lot to continue to promote the good safety programs and creating expectations for your subs. Now, there are the anomalies out there. I mean, there are some folks that there's some challenging things that we've seen. We've seen a couple of examples in the last year of things from a trenching perspective that are just completely unacceptable. But that really has been the exception rather than the rule, from my sense. Craig, do you want to jump in a little bit and you can talk a little directly with the inspectors?
Yeah, I'll jump in just a little bit. So yeah, I concur with what you had said. And I guess my answer to your question, Mandy, is for all industry sectors, I would simply say construction did the best and continues to do the best. Seem to be paying the most attention to it, taking it the most seriously. There's conversations between business and labor. Everyone's trying to work together in a tough time. And early on, we had a whole bunch of complaints and referrals from various members of the public, construction sites all over the state, to the point that we had to actually employ our consultants to go respond to some, along with compliance. And overall, we hardly found anything wrong. There was a perception from a lot of people that things weren't going well, but in reality, we rarely found problems. And if we did find something, it was typically not a major issue. People were trying, and we can continue to give everyone a lot of credit for trying to do the right thing, because this has been tough on all of us. So that's what I'll add to it, Joel.
There is a question pertinent to this. So from Kristen Henderson, what are the violations, that you're finding with regard to COVID on a construction job site?
I'm going to keep going, Joel. Oh, you're muted again, but you're shaking.
Yeah, please. Yeah, go ahead, Craig. Go ahead and take that one.
So I'll keep on going. So first off, we'll have more information down the road. One of the things when I say we're giving everyone credit for trying, that includes ourselves. We're trying to do the best. And one of the things we haven't been able to do completely is identify all of our COVID-related violations. When we first started, we had no way to track it. Now we're catching up and getting that in our system. So for those of you who are going to attend our virtual construction advisory committee in December, we might have some more solid numbers for you. But I can say now, what it typically is, it's going to be related to masking violations is what we've been able to identify. Either no masks are being worn or they're not being worn properly. And we have the 22 inspections that Joel mentioned earlier. Those are ones that we had various masking violations. So that anecdotally is typically going to be what we are finding most. And that's not uncommon with any other industry either. But again, hopefully more specifics in December to tell a more detailed story for you. Yes, ma'am.
Thanks, Greg. So a follow-up, maybe non-COVID question, because I think we all have some COVID exhaustion going on. So you recently published the Unified Fall Protection Standard that went into effect 6 days ago. So despite AGC's opposition to this rulemaking, it went fairly smoothly. But then the next step is obviously implementation within your staff and then your staff in the field carrying out the enforcement of this revised rulemaking. So I guess my question on that is, what does that look like from a department perspective on training your field personnel on new rules, given the COVID scenario of you not being able to do your annual symposium and some of the things that you do to train your staff, but also given the tremendous burden that your team has right now in responding to COVID complaints and imminent danger inspections, et cetera. So what does that look like now? Because obviously the rule went into effect 6 days ago, but my gut check on it and looking at how things are going and my correspondence with the department is there's still a ways to go before your team is fully up to speed on these new rules, and likely probably the same with the steel erection rules.
So I agree. And again, I'll market our December Construction Advisory Committee one more time, because we will be checking in on how things are going 2 months into the Unified Fall Protection Rule and steel erection both. So in general, we have a couple ways that we address training for staff on new rules. If it's completely new, we will try to do in-person training. Pre-COVID. Now it would be online or Skype, however we might do that. On the fall protection rule, the idea there is there really weren't supposed to be many changes. It was typically grabbing stuff from various vertical standards and adding it to the quote unified fall protection rule. And so as far as requirements, there's some changes based on OSHA input, but not a lot. And so we don't have a whole lot of training planned. That's where the check-in a couple months will come in, because we're still spending a lot of time on the COVID stuff. The one thing I do want to say, not really directly related to your question, Mandy, but to those of you who've been following the rule, know that we had issues with OSHA on our exemption for low-pitched and leading-edge work. They are not happy that we left that in. They haven't been happy the whole time. And we chose, as you all know, to go ahead and do that because we thought it was the right thing. That's a decision business and labor have come to for years. Our data shows the rule is effective as is. But just a brief FYI, if the battle is not over, now that the rule is in place, I believe we will still be hearing back from OSHA. So that's, again, if you like the rule the way it is with the exemption, you want to be paying attention as time goes on.
We do deeply appreciate you leaving that exemption in, and we're happy to sit at the table with you and defend that decision. 100%. And knows it. I've said it multiple times, but I'll say it here again. If there's no other questions, I do have one more. And I don't know who exactly from your team, or maybe you, Joel, would like to take a crack at it, but your website got an overhaul last year. There's quite a bit of backlash over usability, quite a bit of backlash about finding content that had previously been on the website. And that was a monumental task on the part of you and your team. So this isn't meant to be a slam on you or the intent behind the process, but frankly speaking, the website still is not where it needs to be with regard to providing information easily accessible to employers that are looking not only for safety violation or safety code language or anything like that, but just kind of soup to nuts on that whole project. It's not all, not everything that we used to have access to is still there. And a lot of the things that we rely on information wise are really next to impossible to find. So I guess my question is, what is your plan for improvement here with the website? Is there still an opening for engagement on this issue? Because it's really important that employers and employees that need to access this information can get to what they need.
Yeah. So Mandy, absolutely. We are committed to continuing to refine what we did. So the good news is that for a number of employers, it got better, because part of the challenge that we had, go back to the old website, there was so much there that you would type in a search for something. And if you didn't know exactly what you were looking for, you would get thousands of documents, none of which were relevant. And so we brought in consultants, we brought in experts, and basically what they said was, you got too much content. And you got to figure out how to organize this around getting the most relevant content. So the intent really was to take some of those best practices from industry and use it to revamp the website. And there were places where that worked. And I think that there were places where it hasn't met the need, and there are some things that are now harder to find. We then honestly ran into some challenges with one of the contractors, that some of the search function that we purchased was not what we thought was not an acceptable level. So we've been working with that contractor to get that fixed. It's better now than it was when it first rolled out. It's not where it needs to be. And I think as a follow-up, Mandy, I'd be happy to have the team that's working on sort of the next wave connect up with you or others at AGC to get some input about, here are the kind of things we need to be thinking about as we continue to refine it, to figure out how to make it so that all people, workers and employers, can easily find the information that they need when they search for it, and that it's easily navigable. And in some ways, the challenge becomes, what's easy to navigate for somebody who uses the website every day is different than what's needed for somebody who comes once every 6 months. And we're trying to figure out how to strike that right balance. And I think we need to be committed to sort of this notion of plan, sort of the basic management technique of plan, do, check, act, which is here's what we learned, here's what we did, where it's not working, we need to figure out how to make it better. So how about if we follow up, do a reach out and follow up with you, Mandy, on how can we get some input from you and AGC about the kind of things we should be thinking about as we move forward. Right. And Liz, can I ask you to take the coordinating role there?
Yeah, happy to.
Thank you.
Okay. There is a interesting discussion going on in the chat between Lori H. and Chris Bowe. Continued discussion about material delivery and truck drivers. And if I may put Lori H. on the spot, if you want to, chime in and explain your questions to the group, and then let Chris respond to that, I think that might be helpful, because I do think it's a source of kind of ongoing confusion for a lot of folks. So Lori H., if you're out there, if you don't mind talking about your questions, that'd be great. Well, maybe she's gone. That's okay.
Yeah, Jerry?
Yep. Chris, go ahead.
Yeah, Lori, if you can, we can take that offline. I'll put my phone number in the chat and just get a hold of me directly, and we'll connect you with prevailing wage, because there's probably some nuances and we can walk through those.
Okay, but Chris, the bottom line with regard to, delivery of material onto the job site in a stockpile, kind of what's the rule?
Yep.
Go ahead and talk about that a little bit, just to make sure everybody knows. Chris?
Yep. Can you hear me?
Now can you?
Okay. What we have for, from stockpile, that's kind of a little bit more nuanced than I can dive into today. But generally, materials that are delivered to public works projects are for the improvement of the public project are covered under prevailing wage. And I'm not overly familiar with the particular rule that Lori is speaking to. So I don't want to provide a lot of misinformation around that to the entire group. So I want to work that out. What we can do is get back to you, Jerry, and once we've worked it out, and you can spread that out on this call, if that will work. Jerry's on mute.
Jerry, you're muted. You're muted, Jerry.
Darn it. If I had a nickel. Lori H. has responded in the chat that she's here, but she can't be heard right now. That's okay. But she does have her contact information. So Chris, if you and she could hook up, that'd be great. And but any other questions out there from the group, just chime in if you got a question. I'll ask one more with regard to the the website, the technology question, a little different from Mandy's question. The contractor portal that L&I has been working on, basically making it easier for generals and subs alike to keep track of projects and who's filed what, and also to be able to more easily upload certified payroll information. I opened it up to the group. Those of you doing public works, how's that working? It seems to be, to me anyhow, to be a significant improvement over the olden days. What do folks think? Anybody want to chime in?
I have just one comment. It's Don Guthrie with Lanes Roofing, and I'm a subcontractor on a lot of projects, Prime on others. But one of the things we see often is a little frustrating is that we will have requests at the end of a period. For example, first of the month rolls around and we get a request through L&I filed on behalf of the prime contractor likely requesting our certified payrolls. And in many cases, our certifieds can't yet be produced because our payroll periods run in, the processing of that time could run another 7 to 14 days, depending on the cutoff period. So it'd be great if there was a better, if there was kind of a qualifier that didn't allow those requests to be made maybe until 5 business days after the end of the month, because technically, if we can't respond in time, we're in default. We're not complying with the law. That's one thing I see as a problem. It's just too efficient for those requests to take place, and it doesn't recognize the capabilities of time cutoffs and subcontractors. And we're pretty astute on what we do. I'm sure people who are less astute have longer time because it just takes longer to process. That's one comment I would have.
That is great input, yes. Anybody else? Okay. Lauren Gooby, ask your question out loud or your suggestion. Muted. Still muted. I'll ask her a question. Lauren would like to be able to pay the right to know bill online versus paper. The recoupment rate would be better for L&I and customer friendly for employers.
Okay, I will capture that. Obviously I can't commit to it today, but let us take that back and bring it back to the folks that are sort of prioritizing the IT work. So thank you, Lauren. Mandy's question, or I thought I saw a question.
Yeah, I was just saying, Craig and I have to hop off, but it was just kind of a general concern for how have your staff fared? I know that you brought your enforcement and consultation team back to get out in the field and start interacting. And I know that they were doing phone triage wherever possible, but how have they fared health-wise and also just adapted to conducting business for the department in these times? Have you guys had a lot of cases? I know probably can't share a lot about that, but have you had a lot of cases, and how is that going for you as an employer?
Craig, you want to go first and then I'll jump in?
Yep, sure, I'll go first. And for DOSH consultation and compliance, we actually never stopped work. We've been out the whole time, taking various precautions for our staff. So physical safety wise, overall, our staff are, I think, doing pretty well. There is a lot of mental exhaustion. It has been tough on them, learning new things. We understand, especially in compliance, that people aren't happy with us. So we have a tough job, but it has gotten much worse because there's lots of non-safety beliefs that we're dealing with now when we try and do our work that I'm sure some of you are aware of, that really puts a lot of stress. And so we have had some people transfer out of compliance, or newer people came in at this time and really didn't like the way it felt. So have left within a year, not understanding this is not going to be the normal. Things will change, but it's been tough. They've been pretty stressed out, and we keep reminding them, because they all want to do a good job. Take your leave. You got to disconnect. You need your own time, and that's from all of us. Joel, as the top leader, says it all the time. And some of us are reminding Joel, as the top leader, he needs to take care of himself too, and take some time off too, because he is a guy's working all the time. So we want him to be well too. So that's what I'd say. Now I'll turn it back over to him.
Thanks, Craig. Yeah, I think so. A couple of things. One of the first things that we've done is we are complying with the governor's expectation around high-risk employees. So there are a number of our staff who are not able to do field work because they're in one of the high-risk categories. So Craig and Ann on the DOSH side have really been looking at how do we divvy the work up and sort of create some new work streams to utilize their skill sets even while they're in the office. In some of our public safety programs, we've actually been looking at trying to do some remote work. are there places where you can do an electrical inspection without having to show up? Or an elevator inspection. So they've been looking at applying some of those concepts. Overall, one of the things we've done as an employer, and again, we're much more office-based than all of you. So we got about 3,000 people. Typically, I would say 2,000-ish or more are office-based. If you think about our claims managers and some of our other staff that spend the bulk of their time in an office. We are primarily working from home and teleworking wherever we can. We have a handful of staff that are still needing to be in our headquarters building or our service locations. We have a pretty rigorous program of ensuring when we are notified of a positive case to do a pretty deep cleaning of that office space if it's someone that had been in the office. We've also adopted a practice of sending a note out to our staff, all 3,000 of us, whenever there is someone that has had a case. And thus far, if my numbers are right, I think we've had about 18 of our employees who have had confirmed COVID cases. 17 of them are actually back to work. The bulk of the folks, again, were more in the office setting. And so we, as opposed to folks that are out there, I think a few of them have been field related staff, but the majority of the 18 confirmed cases have actually been more office-based staff. But we've tried really hard to say, here are the minimal expectations for all of you and all the other employers. And then as an employer, here are the expectations that we have. So when you walk in, for those few employees that are in our office, we're providing masks when they first walk in, obviously, allowing folks to don their own masks if appropriate. We're basically saying we want people to stay home. We're doing all of the video conferencing that we can and just trying to really rethink the work to the extent that we can. And I think in the long haul, if there's, speaking as an employer, again, different than your world, one of the things that we're realizing is that telework works and that we can actually, things that we thought traditionally could only be done in an office setting, that we can actually do this. And we're hoping in the long term, that's going to help us with some recruitment issues. So Lauren can appreciate this, maybe, hopefully this will help us with recruiting claims managers. And if everybody doesn't have to work in our Tumwater building all the time, does that expand the pool of people that can apply for jobs? And does it give us access to a greater array of potential candidates? And then on the flip side, Mandy, you were mentioning this, if we're not going to be together, what do we do in terms of training? And how do we create that training environment where we can replicate what we do in a classroom? And those are a couple of the things that wearing our employer hat that we've been focusing on.
Okay, well, we have reached the 11 o'clock hour, so we're gonna let everybody go, but I wanna thank Joel and Craig and Liz and Chris and anybody else from L&I that's on the call for joining us today. Thanks AGC members for participating. I think this was some good discussion, so let's do it again sometime, but otherwise we'll let everybody go and be safe out there. Thanks, Joel.
Perfect, Jerry, thank you. Thanks everybody from AGC. We welcome the opportunity to do it again. We value the partnership that we have with you and look forward to continuing that in the months and years to come.
Thanks. Okay,
all right,
bye everybody.
Take care, everybody.